Very good evening, friends. Meeting again in the session of the Materia Medica. Yesterday we have discussed one remedy, that is the benzoic acid. And very next remedy to benzoic acid is the Berberis Vulgaris. Very close to each other regarding many aspects. And that's why we have to differentiate those two remedies. Very important. It's very important. And luckily, we are discussing them one after another so that it will be quite easy for you to understand. Before going to the Allen's notes, we're going to learn one case. Generally, what happens? Generally, we used to think about the Berberis vulgaris for the renal calculi very commonly. Yes, it is a wonderful remedy for left ureteric calculi, left renal calculi. But this case was something different. This was the case which I have admitted in my hospital. Patient was in acute state, brought to me and had a very severe pain in right hypochondriac region. It was a gallstone colic. So it was an acute attack of gallstone colic with which patient was admitted and patient was in agony. There was very much severe stitching pain was there. There was bilious vomiting, there was retrosternal burning and pains. It used to start with right hypochondriac region and it enters towards the stomach. And patient, it gets aggravated by pressure. When I started examining, he was not allowing. It was aggravated by moving, it was aggravated by motion, it was aggravated by jerk, it was aggravated by standing. All those things were there. And he was brought to me around, he was 30 years old male, and he was brought to me at around 3 o'clock in the afternoon. He has not passed stool since morning. That was one important thing. There was a lot of urging to pass stools, but it was not happening. And second important thing, that when I looked toward the conjunctiva, there was little bit jaundice. It was icterus was present. He had a bilious vomiting 2-3 times. It was yellowish, very sour, bitter in taste. And he said that yesterday he had stools, and those stools were of little bit clay colored stools. Yesterday, actually, before coming to me, he was seen by one of the surgeon over there, and who said that you go for sonography. But patient refused because he told the surgeon told him that it might be because of stone in the gallbladder, and if it is there, we have to go for operation. There was a tremendous fear in his mind, and so he took that injection. He was better for whole night. In morning, the pain started again. Before coming to me, they went to the sonologist and report was ready. And there was two things. There were gallstones present over there along with cholecystitis. So it was not purely gallstone. It is associated with cholecystitis, and that's why he was having severe pain over there. So this was the case. An acute case, acute gallstone colic. Stitching pain is the characteristic of Bryonia also, this remedy also, very close to each other. Both of remedies have the constipation. But in Bryonia, it is absolute constipation or obstinate constipation. Here, there was a constipation with urging. Third important thing, where I changed the prescription from Bryonia to the Berberis vulgaris, was only one modality that aggravated by pressure is present in the Berberis vulgaris. It is ameliorated by pressure in Bryonia. That was the very important indication with which one can differentiate. Otherwise, all modalities of Berberis vulgaris and Bryonia are same. Aggravation by motion, aggravation by jerk, aggravation by standing, aggravation by walking. All those modalities are very close to each other. In Bryannia also bilious vomiting is there. Berberis vulgaris is also having the bilious vomiting. But in this remedy, this bilious attacks, the biliary colic or gallstone colic, aggravated by pressure, aggravated by all those things, associated with increased uric acid levels, Berberis vulgaris is the best prescription. Many people used to use the Berberis vulgaris Q. Yes, Berberis vulgaris Q reduces the uric acid level definitely. In this case, what I have done, I have given Berberis vulgaris 200 in potentized form, 3 doses every 15 minutes, and I have given, along with that, the same mother tincture, I have continued him. And I have admitted that patient just for observation. After giving 3 doses of Berberis vulgaris 200, within span of half an hour, 2 hours, the pain started reducing. He was in lying down position. He was able to change the position, and later on it settled. There was no vomiting thereafter. But I asked him to remain nil by mouth till evening, and he was kept on just he was kept for an observation. Till night, he never had a vomiting. The pains has completely stopped in the night. So I asked him to take liquid diet just on that day. Next day morning, he was hungry. He said that, doctor, yesterday night I never had a dinner, so I'm hungry. Can I eat something? See, these are the generalities. If generalities are improved, your remedy has acted. Then I asked him, yes, you can take the soft food, soft diet today. And I have discharged that patient in the afternoon. Asked him to meet me next day. Next day, he was absolutely normal, no more vomiting, no more pain in abdomen, nothing. And he was continued with the treatment for 6 months. After Berberis vulgaris, I have given him sulfur depending upon whole case later on I took. And with sulfur, one thing has happened. After sulfur, he developed a rash all over the body. And that with that rash, he was better internally, but with that rash, everything vanished. After that, I have repeated the USG and stones have been completely vanished. This was a wonderful cure which I have seen, that yes, gallstones gets dissolved with the help of homeopathic medicine if you give the right remedy, and even acute state of gallstone colic can be handled with the Berberis vulgaris. It is a wonderful remedy for gallstone colic. Generally, we used to think about this remedy for the left renal calculi. 100%. It is a wonderful remedy for left renal calculi, left ureteric calculi. And there is very typical sensation which has been mentioned in the books is the bubbling sensation. And yes, that is very typical from left loin to groin, that typical ureteric pain, which is characteristic of this remedy. So no doubt it is a wonderful remedy for that, but one should not forget this remedy for the gallstone colic. So this is the case which I want to share with you, and then I want to discuss about the Berberis vulgaris from the Allen's notes. Let us open and learn this the Berberici family, Berberis vulgaris. The renal and vesical symptoms predominate. So first line itself indicates directly the action, center of action. It is bladder and kidneys, ureters. Pain in small of back, very sensitive to touch in the renal region. What is small of back? Many times in our Materia Medica, this sentence is used, small of back, pain in small of back. Even it is present in ischulus also. Small of back means belt area. Where there is a crossing, the sacroiliac joint is there. So that area, the belt area, is called as small of back. So pain in small of back, very sensitive to touch in renal region also. Aggravated when sitting and lying down. So pains gets aggravated whenever patient sits and lying down. Aggravated from jar means jerk. Aggravated from fatigue. Jerks aggravate, motion aggravates, walking aggravates, standing aggravates, pressure aggravates. All those features are very characteristic of this remedy. You get these features, whether it is ureteric calculi, whether it is gallbladder calculi, these are modalities are quite common. Burning and soreness in the region of kidneys, numbness, stiffness, lameness with painful pressure in the renal and lumbar region. See, numbness is also there, the stiffness is there, and lameness. Lameness means a weakness which develops because of pain is called as lameness. The person who is not able to work with that specific part, the part becomes lame because of pain. That is lameness. Lameness with painful pressure in the renal and lumbar regions. Pale earthy complexion. See the constitution of this Berberis vulgaris patient, they are pale, earthy complexions with sunken cheeks and hollow, blue encircled eyes. So dark rings around the eyes, that is one more important thing which you can observe in Berberis vulgaris. This remedy is the remedy, deep acting remedy. It is not acute only. Its space is acute, but this has a deep constitutional remedy, or it is anti-miasmatic remedy. It covers the psychosyphilitic miasm. Because this is the remedy in which you get the fistula in ano. That is another feature which is there. So this remedy has a miasmatic focus around the psychotic to syphilitic miasm. And second important thing which you can find it out, that action, it is 20 to 30 days action the Berberis vulgaris is having. So it is a very deep acting remedy. Rheumatic and gouty complaints with diseases of urinary organs. This is a combination. This sentence is urinary complaints associated with rheumatic and gouty complaints. Think of Berberis vulgaris first. So you have to be very, very watchful regarding the accompanying symptoms, what they are along with the main symptom, along with the chief symptom. If these combinations are there, then it is rather simple to reach to the remedy. And that's why the symptom, rheumatic and gouty complaints with the diseases of urinary organs or diseases of urinary organs associated with rheumatic and gouty complaints, vice versa. Colic from gallstones, given in italics. Never forget this remedy in acute gallstones. Bilious colic followed by jaundice. So there is bilious colic, very severe colic with bilious vomiting, with jaundice. Clay colored stools. There is fistula in ano with bilious complaint symptoms and itching of the parts. Short cup and chest complaints, especially after the operations for fistula. See, this is very important symptom. Patient goes, fistulectomy is done, and patient start getting the cup, and it is not getting settled. Three remedies one should not forget. First is Berberis vulgaris, second is Calcarea fos, third is silica. These are three important remedies for such type of symptom. So, bilious colic, the colic from gallstones, the pains which are related to or radiates to the stomach, very important features which one must know. This remedy is very nicely explained by Boric also. My suggestion to all of you is go to the Boric's Remedica to read this remedy. You will going to understand more features about the Berberis vulgaris. See the type of pain, the stitching pain, cutting pain from left kidney following the course of ureter into the bladder and urethra. So it is left renal ureteric colic, very typical from left loin to groin, like tabacum. Tabacum is having also left renal colic. The right kidney, it is lycopodium, everyone knows. Renal colic aggravated left side, like tabacum, either side with urging and strangury. Very severe burning micturition, spasm in the urine, burning, that is strangury. If bilateral colic is there, the cantharis is the remedy. Generally, it is not because of stones, it is because of the pyelonephritis or infective focus in present in cantharis. Bubbling sensation in kidneys like medorinum, bubbling, budbudeala circle, the bubbling sensation. It is patient understand that urine is passing in that specific direction. Urine, the type of urine. That is very important. Urine is greenish. It is blood red with thick slimy mucus. Urine is transparent. Urine is reddish or jelly-like sediment. So generally, because of the renal calculi, a strong urine is there, and that urine has multiple colors. Generally, it might be greenish to dark red or reddish or dark colored, and there are sediments. There is one patient with me, and who used to come that, doctor, today I have passed 3 stones, 4 stones. He used to come again and again, again and again, again and again. Luckily enough that he doesn't have the pains, but it goes on passing and it goes on developing in that patient. I have given him lycopodium. With lycopodium, they are passing continuously, and he was getting settled. Earlier, he used to get very severe pains. Movements brings on or increases the urinary complaint, and that is very typical of this remedy. And that's why it goes very close to the bryonia. It looks bryonia because stitching pains are there, the movements aggravate the pain. It looks bryonia, but bryonia pressure ameliorates. Here it is pressure aggravates. Relationship similar to Cantharis. Yes, Cantharis is generally a remedy for urinary tract infections, very commonly. Cystitis, Cantharis is very important remedy. Lycopodium, as you know, very important remedy for the renal calculi. But in Lycopodium, it is more on right side. In Berberis Vulgaris, it is completely on right side, the left side. Sarsaparilla is also good remedy for renal calculi associated with the urinary tract infection. There was a very typical sensation as if some urine is still remaining in the after passing the urine. The tabacum, it is very specific with the left-sided renal colic. So these are the remedies which he explained over there to compare for the urinary complaints or for renal colic. Acts well after. So this remedy, Berberis vulgaris, acts well after arnica, after bryonia, after Calibicromicum, after rust ox, after sulfur, in specifically in rheumatic affection. Whenever you get the gouty rheumatism, my suggestion to all of you, use the Berberis vulgaris Q and give it 15 drops twice a day in a half cup of water for even for months. It removes the uric acid crystals very easily. This is a good hint and it helps a lot to reduce the uric acid levels drastically. Even in renal calculi, gallstone colic, to reduce the uric acid levels, Berberis vulgaris Q plays very vital role. Last general modalities, aggravation. Aggravation by motion, aggravation by walking, aggravation by carriage riding, aggravation by any sudden jarring movement. So any sudden jerk generally aggravates the pain. So movements aggravates, that is the characteristic of the standing aggravates, the pressure aggravates, all those modalities are quite common. The biliousness of attack and bilious vomiting, bilious colic, this remedy is the wonderful remedy one should not forget. So this is Berberis vulgaris, which we have learned from the Allen's keynotes. My suggestion to all of you, must read it from the, even from the Murphy's book, Murphy's keynotes, and from Borix Mathematica. You will get a more detailed understanding about this remedy. And this is very common remedy. The summer is just has been started, and during summer we should be very much always ready for treating the renal calculi. The renal colics, ureteric colics, they are quite common in summer. This is one remedy one should not forget for the renal and ureteric calculi. So that's all for today. We have finished one more remedy from third year syllabus. Tomorrow we'll start with new one. So we are going ahead with day by day with clinical understanding of the remedy, and we are comparing the remedies from one another so that it becomes very easy for us. So that's all for today. If any question is there, we can have a chat. Otherwise, we'll conclude. So that's all for today.
Sir,
One minute.
can we use?
You have given mother tincture as well as
Potency.
potentized at the same time.
Yeah, I I have started with potentized remedy, 3 doses every 15 minutes, and later
Yeah,
continued with the mother tincture.
okay.
Because uric acid crystals, if you are able to remove with the directly with the mother tincture dose, it helps a lot. It enhances the speed of recovery. Okay.
Thank you.
Hello,
Any
sir.
Amit?
Sir, can you use lycopodium and berberis uh, together?
Lycopodium you can give in potentized form, definitely
Yeah.
followed by Berberis vulgaris mother tincture.
Okay. Simultaneously, we can give, sir.
Yeah,
Like
after lycopodium you should not repeat. It is very deep acting remedy. It is a
yes,
very
sir. Yes.
very deep acting remedy. So lycopodium you should not repeat too much. Give 3 doses followed by Berberis vulgaris Q.
Yes, sir. Yes. Okay. Thank you, sir. Thank you very much.
Okay. Anything else?
Hello.
Yes.
Sir, up to what of calcula we can remove with this medicine, sir?
I'm not getting your question. What you are asking? Repeat, please repeat the question.
Sir, up to what size of the calculus it can be given?
After calcarea, how much size of the stones? That is your
Yes, sir.
question. Yes, yes.
Yes,
Okay.
sir.
No. So it varies. First important thing, if it is in the bile duct, you should be very cautious. Generally, you should not wait. At that time, if there is a severe jaundice because of biliary obstruction, obstructive jaundice is there, my suggestion is that go for surgical intervention and don't take a chance, because it is an acute emergency and sometimes it may cause damage. So in such types of cases, you must be cautious enough. But when you are using it for gallbladder calculi, the size doesn't matter. It doesn't matter because it will not going to harm the patient immediately, and you have time to treat those patients. Only thing is that to tackle the cholecystitis, if it is associated, it is important, because cholecystitis itself used to produce the pains, and those pains you have to tackle. So if it is associated with cholecystitis, definitely we should be cautious enough. If it settles, then you can treat it, take your own time, and you go on treating. You can treat for longer time of duration. Radiating, there was one question, explain about radiating pain. Radiating means going from main area to some other area. It was from right hypochondriac region to the stomach, or it goes from left loin to groin. That is a radiation. Loin means anterior side of lumbar region, left lumbar region to left loin, and groin means going into towards the just in the inguinal area. That is what is loin to groin, and not anteriorly, posteriorly. Sorry, left region. That is the loin, left loin. Okay. So that's all for today. Thanks a lot and good night.
Thank you, sir. Good night.
Okay, there was one question, circumscribed pigmentation. It is circumscribed means it is completely specified in specific area. It looks generally a circular or localized. That is circumscribed pigmentation. It localized to a particular area. Okay, good night. We'll meet tomorrow. Thanks a lot.